Good morning, everyone. May 16th, Board of Control, will the clerk please call the roll?
Good morning, calling the roll for the Monday, May 16th Board of Control meeting. It is 11:11 a.m. We have Trevor McAleer serving as an alternate for Nan Baker.
Here.
We have Jim Boyle serving as an alternate for Pernell Jones.
Present.
We have Nicole English serving as an alternate for Mike Dever.
Here.
Mike Chambers serving as an alternate for Armand Budish.
Here.
Lee Tucker serving as an alternate for the fiscal officer.
Here.
Paul Porter.
Here.
We have a quorum.
Okay, thank you. Next on the agenda is the minutes of May 9th. I'll make a motion to approve those minutes. Is there a second?
Second.
We'll give it to Mr. Boyle. Second from Mr. Boyle. All in favor, say aye.
Aye.
Opposed? The item is approved. Is there any public comment?
No public comment.
Let's move on to our first item.
The first item is BC 2022-295. Department of Public Works submitting an amendment to contract number 11 with Tri-Moore Corporation for the reconstruction of Apron H and Taxway B at the Cuyahoga County Airport for additional funds in the amount not to exceed $31,471.19.
Nicole English with Public Works. This is an amendment for a construction contract at the airport, mostly related to unforeseen circumstances. So when they pulled up pavement, either additional repairs needed to be made, or at one point they had run into a concrete duct that they didn't anticipate and had to work around that. So they were all described further in the materials that are provided. This is 100% paid for by the FAA, no county money.
Thank you, Ms. English. Are there questions from the board on this item?
Yeah, It's in 3 cities, the airport is. The airport's in 3 cities, yeah.
They got pieces, parts, yeah.
Yeah, I don't know why it just says 1, though. That's weird, but you're right.
Okay. Outside of that, any additional questions, comments? Seeing none, make a motion to approve the item. Is there a second? Second by Mr. Boyle. All in favor, say aye.
Aye.
Aye. Opposed? The item is approved. Next item.
Next item, BC 2022-296, Department of Public Works recommending an award on an RQ 8325 and enter into contract with Active Plumbing Supply Company in the amount not to exceed $93,503.07 for the purchase and replacement of 12 hot water heaters at the Juvenile Justice Center, commencing upon contract signature of all parties for a period of 1 year.
Good morning, Tom Pavich, Public Works. This is approval of contract with Active Plumbing. It's replacement of older aged hot water tanks over at the Juvenile Justice Center. I think there's 2 different sizes, a total of 8. This was a formal bid. We had 2 bids, 1 was compliant, and we're submitting the award to that vendor.
Okay, thank you, Tom. Are there questions from the board on this item? Seeing no questions, I will make a motion to approve. Is there a second?
Second.
Seconded by Mr. McAleer. All in favor, say aye.
Aye.
Opposed? The item is approved. Next item.
BC 2022-297, Department of Public Works recommending an award on RQ 7409 and enter into a contract with Orkin LLC in the amount not to exceed $117,000, $117,120 for integrated pest management services for various county buildings for the period April 1st, 2022 through March 31st, 2025.
Good morning, Tom Pavich again. Public Works is a board recommendation. Orkin's the county's pest management contract. It's a 3-year contract. This was bid out competitively as a formal bid, went to 11 vendors. We had 2 bids submitted, and Orkin was the lowest and most compliant vendor.
Thank you, Tom. Questions from the board on this item? Seeing none, I will make a motion to approve. Is there a second? Second by Mr. Boyle. All in favor, say aye.
Aye.
Opposed? The item's approved. Next item.
Next item is BC 2022-298, Department of Development submitting an RFP exemption, which will result in an award recommendation to CHN Housing Capital in the amount not to exceed $500,000 for administration of the down payment assistance program to eligible homebuyers in Cuyahoga urban county communities and the city of Parma for the period May 1st, 2022 through April 30th, 2023, and recommending an award in connection with said RFP exemption.
Good morning, Sarah Parks Jackson, Department of Development. We are recommending a award to CHN Housing Capital to administer the county's down payment assistance program, which is funded with federal home dollars, of which the city of Parma is a member of the consortium and has chosen to participate with us in financing the administration of this program.
Thank you, Sarah. Questions from the board? Seeing none, I will make a motion to approve the item. Is there a second? Second by Mr. McAleer. All in favor, say aye.
Aye.
Opposed? The item is approved.
Thank
Next
you.
item.
BC 2022-299, Department of Information Technology, on behalf of the Domestic Relations Court, Probate Court, and the 8th District Court of Appeals, submitting an RFP exemption, which result in an award recommendation to Integrated Precision Systems Incorporated in the amount not to exceed $72,900.85 for a state contract purchase of security cameras and video storage servers for installation at the county courthouse, and recommending an award in connection with said RFP exemption.
Morning, Board. Dennis Sullivan, Department of IT. As was just read to you, this is with IPS. They are a state contract. This is an extension of surveillance and video systems over at the county courthouse. On behalf of the 3 agencies mentioned, State Term, as the others are, you should be pretty familiar with IPS. They're a handful of years ago, the decision was to standardize them and so that everything could be integrated and the networks could all talk.
Okay, thank you, Dennis. Questions from the board? Mr. Boyle.
This is only the old county courthouse, right? The court's there?
I believe so,
Yeah, I
yes.
think that's what's in there. They don't need it now, but we have contracts, I assume, for juvenile and common pleas or court tower, I assume? Do we know?
If installation was made there, we maintain a
Got it.
general maintenance contract. They roll in after their initial installation into a maintenance contract.
That's fine, that's what I,
And everybody eventually is gonna get with IPS since that decision was made a couple of years ago.
so they'll all be unified, got it.
That was the plan, yeah.
Still with that plan, right?
You're driving that plan.
Are there additional questions on this item? Seeing none, I will make a motion to approve. Is there a second?
Second.
Seconded by Mr. Boyle. All in favor, say aye.
Aye.
Opposed? The item is approved. Next item.
Thank you.
BC 2022-300, Department of Information Technology, submitting an RFP exemption, which will result in an award recommendation to Bug Crowd Incorporated in the amount not to exceed $32,989 for the purchase of a Vulnerability Disclosure Program Essentials platform for the period March 31st, 2022 through March 30th, 2023, and recommending an award in connection with said RFP exemption.
Good morning, Dennis Sullivan again. I think I'm gonna let Jeremy speak on behalf of this, but I can tell you that this purchase order was, it was bid out. It was posted, a full week and received TAC approval back in mid-April. And as far as the timeline, Jeremy can cover that with you, along with, how Homeland Security made this a mandate and how we proceeded from there. Thank you.
Thank you. Jeremy Mio, Department of IT. This item is for our vulnerability disclosure program. This is to give the ability for security researchers, the public, to have a streamlined method to report any issues with county public applications or services. There was a mandate done in 2020. Directive 20-01 of Homeland Security, mostly associated with elections as well as government, public government services to have the vulnerability reporting. The county uses Bug Crowd to manage those reports, so they have the technical expertise to review if there's a real issue within the scope. So we don't have vulnerabilities that are disclosed from the public sitting in a mailbox waiting for one of our website developers or a security team if we can't get to it, and we might spend hours reviewing it and it might not actually be an issue. So Bug Crowd provides not only the services, but the platform to review and report those issues. The item is a late item. It was originally purchased through CARES funding. We were reviewing the operational, to switch this to operational as we will have this going forward. So it took a little time to make sure that we had the right funding sources. So that was a little late due to me trying to find the right codes due to some of our budgeting items. But we will go forward with the operational cost of this item. If we do additional renewal, we'll probably do a renewal for 3 year, do a little more of an RFP this time to have some time to get for the newer budget. But that's the item, and I'm open for questions.
Thank you, Jeremy. Questions from the board? Mr. Mackler.
Jeremy, as you mentioned, right, the original item was purchased, I believe, through an emergency purchase, right, with CARES funds, I think, as Council President signed off on that, I believe, a while back.
So it was initially, but the actual emergency purchase was during the CARES and the COVID pandemic early on. Bug Crowd actually had a 90-day free program. So we ended up doing a $0 emergency purchase with the emergency purchase process. We ended up also using CARES, but we went through the bidding process for that.
Okay. And then I guess this question is probably for Paul. If we did bid this out, why do we need the exemption then, if we bid this out?
It's an informal bid, under 50,000.
So if it's an informal bid and under 50,000, it could be done as an award. Do you know if there was anything with this one that prevented it from being presented as an award rather than an exemption when it was bid out most recently?
I would defer to.
Okay. Sure,
Is it because there are zero bids?
that's probably
Probably
what
what
it
it
was. If they didn't bid on it when the informal bid was out, and instead they gave us a quote on it, it would have to go as an exemption, Trevor. Yeah. So that's why it's an exemption and not technically an informal bid, because the vendor did not submit a bid. And, you know, vendors do that from time to time. And then probably what happened was IT followed up and said, we didn't get a bid from you guys. Are you willing to enter into a contract? And that's why it's done as an exemption instead of an informal bid.
That is what Janelle told us last week, I think, on the call.
Yep.
Okay. All right, so if they would have submitted a bid, we would not have needed the exemption component of this?
Correct.
Is that a county code rule or ordinance, or is that state, or what? Okay, I just, and we've talked about this before, Mr. Chair, right, we did try to solicit bids, and I just don't like the appearance of the exemptions. It looks like we are just trying to take the easy way out, and in fact, we did try to solicit bids, and I would just, if it's a county code issue, we can potentially revisit that, because it's not we tried to get bids, and it looks like we're not doing a competitive process regardless of what the backup says.
And even, Trevor, to make it more in line with what you're saying, I mean, from what you've both articulated, Dennis and Jeremy, this is required by, it's a mandate from Homeland Security, so it's not like we cannot do anything. I mean,
Well, you could, and then you
Well,
probably get synced, I don't know what the
That's
recourse is, but yeah.
perhaps that's right. So I hear what you're saying, Trevor, and I mean, it is, in my mind, a little surprising that if this is a mandate from the feds, presumably to every governmental entity, I would have thought that there would have been businesses that would be ready, willing, and able to get into this contractual relationship across the country, but perhaps, you know, the timing is wrong or whatever, I don't know.
And there are, but, you know, we're probably one of the smallest entities, right, compared to the global realm of vulnerability disclosure. Just to keep that in mind,
Fair
right?
Yeah,
I don't like it to be
it's the
that
process
Jeremy
we
Meo's
have,
the
though, I
hero
mean.
of the conversation here, but
We can look at it.
I do think he's done the right thing here.
But we run into this all the time. I mean, bidders just, they don't want to go through our system. They don't want to do whatever, you know, they want to send you a quote, and maybe it doesn't come in the right time or the right format. And you're right, I mean, now it looks like an RFP exemption, but we did do solicitation, so is there something in between?
And it does say in the backup information that the procurement method was an RFP that received 0 bids. So we're on the record indicating that it was bid out. We do have discretion locally here to make that decision. The revised code isn't this specific about this. But to Mike's point, this is our process.
Right.
I think generally, you know, we want departments to follow the bid process. There are instances where if the department had time, we could have done like a second effort versus just getting a quote. But because this one was already behind, it makes more sense in this case to just enter into the agreement with the vendor by exemption rather than dragging out the process further for another bid. A different circumstance, if we were bidding out something for like a purchase that wasn't late or we weren't kind of behind the clock, we'd recommend that the department do a second effort instead of just the quote.
And just to add to the directive and mandate of Homeland Security, it's not that we have to use a third party for this, it's just that we're using a third party to be able to, you know, provide a quick solution, so we are not, you know, all of a sudden, to make our process easier on staffing time. It's not a directive to use a third party, but we're using this third party to meet the directive.
I mean, I agree with you. We could have a conversation on it. I mean, even the state contract, that was bid by the state of Ohio. I mean, we're going through this whole process, and it makes it look like we didn't bid it, but it was formally, you know, so.
And Paul, I agree, it's in the backup, but right, people just people just look at this, and it just looks like,
Right.
oh, county's being lazy, they don't even want to bid it. And, right, Mr. Chairman, the one above it,
Right,
state term,
same
right?
thing.
So,
Maybe we can work with our law department,
oh,
take a look at it.
Jeremy, have they found, because we've been using them, what, for now, a year and a half,
Yeah.
somewhere in there? Have they provided recommendations or report anything to you that you've had to change the way we have been doing business? I mean,
We have luckily not had to escalate a fix through the system. That doesn't mean that things have not been reported
yeah,
through the system.
but they're reporting stuff to you, right? I mean, that is helpful.
It is helpful. It's one of those things, unfortunately, that is helpful when there's something reported versus, if there's nothing reported, that means we're actually doing pretty well with our website deployments and our applications out there. So, as much as, if we're not getting any reports, it's not that the system isn't working or, things aren't, happening. It's just that we might be, better with some of our modern websites and things like that.
Thank you.
Okay, good discussion. Maybe we'll follow up and see if we can
Yeah.
come up with some ideas. Okay, hearing no additional questions or comments, I'll make a motion to approve the item. Is there a second?
Second.
Seconded by Mr. McAleer. All in favor, say aye.
Aye.
Aye, opposed? Item is approved. Next item.
The next item is BC 2022-301, Department of Information Technology submitting an RFP exemption, which will result in an award recommendation to Anaconda Controls Incorporated in the amount not to exceed $25,000 for uninterruptible power supply maintenance services, commencing upon contract signature of all parties for a period of 3 years, and recommending an award in connection with said RFP exemption.
Good morning again, Dennis Sullivan from IT. As was just read into the record, this UPS maintenance services, if approved today, would have a 3-year period, 5/16/22 to 5/15/25. This is a not-to-exceed contract. As you can imagine, the hardware breaks, fails, and is replaced and added to for new sites or subtracted for sites that close. So there's an ebb and flow to the contract, and it's paid upon services. The items that are being covered are inspected for and preventive maintenance checks at least twice a year while they're on the active inventory.
I have a quick, I've seen a lot of these coming in the last, this power supply interruption. I mean, different buildings, is that how we're doing this, or is this, maybe I'm
Well,
looking at that wrong?
Yeah, it's different locations and it's different agencies that don't participate in the master contract that aren't under the executive purview.
I got you, okay. Are there any questions from the board? Ms. English? No, sorry. Okay, seeing no questions, I'll make a motion to approve the item. Is there a second?
Second.
Second by Mr. McAleer. All in favor, say aye.
Aye.
Opposed? The item is approved. Next item.
Thank you.
Next item, BC 2022-302, Office of the Medical Examiner, submitting an RFP exemption, which will result in award recommendation to Friends Service Company Incorporated doing business as Friends Office in the amount not to exceed $44,146.56 for a state contract purchase for the replacement of conference room furniture, including 70 stackable chairs and 33 tables, and recommending an award in connection with this said RFP exemption.
Hugh Shannon, Medical Examiner's Office. So we're keeping it simple for Mr. Boyle, just chairs and tables today. This is an RFP exemption after 2 bids went out, and the only one that came back was a state term. So that's why it was done this way. We have 2 large conference rooms that we hold trainings in. We are consolidating the existing tables and chairs to get one good set and then doing a full replacement for another, save a little bit of money.
Okay, thank you, Hugh. Are there questions from the board on this item? Okay, seeing no questions, I will make a motion to approve the item. Is there a second?
Second.
Seconded by, look like Lee Tucker. All in favor, say aye.
Aye.
Opposed? The item is approved.
Thank you.
Next item?
Next item, BC 2022-303, Department of Health and Human Services, Cuyahoga Job and Family Services, submitting an amendment to contract 938 with Catholic Charities Corporation for pre-employment screening services for Ohio Works First applicants for the period July 1st, 2022 through June 30th, 2022, to extend the time period to June 30th, 2023, and for additional funds in the amount not to exceed $480,000.
Good morning, Marcos Cortez with the Department of Health and Human Services, on behalf of Cuyahoga Jobs and Family Services. Again, this is an amendment with Catholic Charities for the pre-employment screening services for Ohio Works First applicants. This is to extend the time and add funds. This amendment provides comprehensive on-site pre-employment screening for all referred OWF and SNAP applicants being approved for cash benefits, SNAP benefits, and OWF recipients whose 36 months have expired or have been sanctioned. The screening evaluates an applicant's job readiness and identifies potential barriers to employment prior to being assigned to a work and training activity. This project is mandated by the Ohio Revised Code. This is the second of our option years for this contract.
Thank you, Marcos. And before I ask for questions, let's make the record note that Councilman Baker and Miller are here, too.
Thank you.
Are there any questions on this item from the board? Seeing no questions, I will make a motion to approve the item. Is there a second? Seconded by Ms. Nicole English. All in favor say aye. Aye. Opposed? The item is approved. Next item.
Next item, BC 2022-304, Department of Health and Human Services, Community Initiatives Division, Family and Children First Council, submitting amendments to contracts with various providers for the Teen Pregnancy Prevention Program for the period January 1st, 2019 through December 31st, 2021, to extend the time period to June 30th, 2023, to amend contract language in Article 10, Section 10.1 regarding insurance, and for the additional funds in the amount not to exceed for Beach Brook, $120,000, for Planned Parenthood of Greater Ohio, in the amount not to exceed $190,000.
Good morning, Kathleen Johnson, for representing Family and Children First Council. This is for the contract for teen pregnancy prevention. It's for the curriculum is for the responsible behavior for sexual education. The school districts being served is South Euclid-Lyndhurst and Cleveland Municipal School Districts. The contracts amount are $120,000 for Beach Brook, and for Planned Parenthood is $190,000. It's for the option year 3. The contracts were late because there was a problem with our budget codes, and we thought we did not have the funding to have these two contracts be amended, but we did meet with the OBM department and the fiscal department, and we found the money. So we are presenting these contracts. It's going to be extended until June of 2023. I do have the statistical data to show that the services are valuable. There were approximately 1,246 youth served. We have 1,122 pre and post tests that were returned to our evaluator, which is Case Western Reserve. There was a statistical difference of 14.55%, showing that the students increase in knowledge to show that they know to use responsible, or to be more responsible if they did engage in sexual behavior. And I'd be happy to answer any more questions.
Thank you, Kathleen.
You're
Questions from the board? Councilman Miller, please.
Yes, good morning. Thank you
Morning,
very
sir.
much for the presentation. My question is whether we have any information as to whether the increased knowledge that was demonstrated translates into better behavior.
So the way that the pre and post surveys are tracked is very limited because it doesn't let us, or doesn't allow us to track like real-time data into like real sexual behavior. Like we only are able to track students by the pre and post test. So we don't have like names, so we don't know if they're actually becoming pregnant throughout high school. We don't know if they're actually having children. At that point in time, we're very limited into what kind of information we are able to obtain because of confidentiality really, to actually match up to see, are they having sex? Are they getting pregnant? Because of the way, because the data is de-identified. So it's really, really, really hard to be able to track. All we are able to do is do the pre and post tests. So it's really hard to answer that question, sir.
So, my follow-up question would be, whether there's any studies elsewhere in the country that would help you to answer that question. If a study showed that that yes, the increase in knowledge also generally results in positive changes in behavior if other researchers doing evaluations were able to overcome some of these problems, well then you might be in a position to conclude that if yes, you get the positive change in knowledge, then you're able to assume you're probably going to get the behavior change.
So yes, there's a committee through Case Western Reserve with, and I can't recall her name, and I can get you that information that I used to go and attend the meetings. So there's a lot more data out there, but the real problem is with the schools and asking them to allow us, and it's really the parents and their rights in enabling us to get that more in-depth information.
Okay, thank you.
You're welcome.
Yes, please.
Just to follow up on that a bit, wouldn't you know by having less teenagers pregnant?
So the problem is the data that we get from the states and from the birth certificates, there's always a lag year. So the birth certificates, and they group 18-year-olds with the teenagers. So for instance, they'll group a 18-year-old with a 17-year-old within that birth year with vital statistics. So we can't really weed out an exact true number of who's being pregnant, whether they're 17 and 18. Because technically, if you're 18, you're an adult.
Right, but can't you at least take a look back from the previous year to see that there's a trend of those pregnancies decreasing, and in those decreasing years, they're 14-year-olds and 15-year-olds?
You could, but it would be also hard for us to say that those are our kids because we don't have that identified child, because the information is coming in de-identified from that school district. So we couldn't technically say Kathleen Johnson did get pregnant at 14, and then she was pregnant at 18, because we don't know it was really Kathleen Johnson, because we don't have that information from the beginning because of the de-identified data.
Okay, would be somehow good to know. I'm not sure how you get around that, but
No, it's really because of their privacy.
yeah. Okay, thank you.
You're welcome.
Mr. Boyle, please.
In the follow-up responses, you indicated that, or at least it was indicated that the districts that are involved are South Euclid, Lyndhurst, and Cleveland Muni, and possibly East Cleveland. When will we know whether East Cleveland is going to be involved? What are the factors that would let them be involved, and does that impact the bottom line of the not-to-exceed cost?
So we've tried to have East Cleveland be involved for at least the last year or two, and then COVID hit prior to that. So we would still be able to add them on board. We had the funding to do so. They just couldn't get on board. They had a lot of problems, during the COVID year. We do have some other programs in their district, so we will try again to get them on board to participate in the program.
And the final question that I have is I think for law. I see on there that we're also not just adding time, money, but also adjusting the insurance provisions. What did we adjust? Do we know?
Likely cyber, I'm guessing, but go ahead.
That would have been between probably HHS counsel, Tyra Taylor, so I can follow up with her.
Yeah, just shoot me an email, that's fine.
Okay.
I would assume it's probably cyber
It seems
insurance.
to be the big thing lately, so, yeah.
I think so, especially based on the date of the original contract. It was 2019, and our insurance requirements have evolved substantially since then. So I bet that's what it is, but I think Tyra would give a better answer.
Thank you.
Okay. Thank you. Any final questions on the item? Seeing none, I'll make a motion to approve the item. Is there a second? Seconded by Ms. Nicole English. All in favor, say aye. Aye. Opposed? The item's approved.
Thank you.
Next item.
Next item, BC 2022-305, Department of Health and Human Services, Community Initiatives Division, Office of Homeless Services, submitting an RFP exemption, which will result in award recommendation to Case Western Reserve University, Center on Urban Poverty and Community Development, in the amount not to exceed $50,000 for research and evaluation services utilizing the Childhood Integrated Longitudinal, I'm sorry, I can't pronounce that one. Data system to support planning and data needs for use within the continuum of care system for the period January 1, 2022 to December 31st, 2022.
Good morning again, Marcos Cortez with Department of Health and Human Services on behalf of the Office of Homeless Services. This is a contract with CASE. CASE again operates the Childhood Integrated Longitudinal Data System, the CHILD system, which is a comprehensive integrated data system used to carry out research and evaluation in order to improve child health and well-being in Cuyahoga County. CASE will use the CHILD system to provide homeless services with a thorough understanding of cross-system engagement for youth within the continuum of care. This was funded off a grant, a HUD grant. Homeless Services was awarded this HUD planning grant during the fiscal year 2020 Continuum of Care competition. This grant is designed to improve service coordination across the homeless continuum of care. Homeless Services is issuing subgrants to providers that focus on specific homeless population issues.
Okay, thank you, Marcos. Questions from the board? Please.
So this is January 2022, and it ends at the end of the year?
Yes.
I mean, there's only maybe, 8 months left in this year? How is it that we lost those months because it's late?
Part of it has to do with the nature of the grant. You know, we didn't get notified about the grant until late last year, and then we had to work with these providers to, develop the parameters about what we wanted to do. I know that when CASE does their work, part of it is setting up their system to be able to produce the information that they need. The meat part of it is really that data analysis piece that comes afterwards. So I'm sure they're ready to go with the reports, and just then to evaluate for the rest half of the year, provide the reports, the analysis to the department.
So we're not hurt by only having about 7 months left in order to come up with this research?
I don't believe that we are.
Okay, thank you.
Sure. Are there additional questions? Seeing none, then I'll make a motion to approve. Is there a second?
Second.
Second by Mr. Boyle. All in favor, say aye. Aye. Opposed? The item's approved. Next item.
Next item is BC 2022-306, Department of Public Works submitting an RFP exemption, which will result in award recommendation on a purchase order to the Safety Company, LLC, doing business as MTech Company, in the amount not to exceed $905,461.72 for a state contract purchase for the replacement of one Dynavac straight jet truck and 2 Q's TV trucks for the sanitary division.
Good morning, Tom Pavich again, Public Works. This is approval of purchase order. It's with a new jet truck and 2 camera trucks for our sanitary division. This is purchased through a state of Ohio contract, which, as you know, those are always competitively bid and open solicitation. I think there was a pre-question. These are replacements. The other 3 vehicles will be auctioned off on GovDeals once we take delivery of these, probably next year.
Thank you, Tom. Questions from the board? Mr. Boyle.
What's the lifespan of these things? I mean,
Typically 5 to 8 years.
is that
So-
how old the ones we're getting rid of?
No,
are?
so the current jet truck, I believe, a 2008.
Wow.
2000, yeah, that's 2008, and the cameras are 2009s. And keep in mind, we also run these on 2 shifts. So we run these until, we start seeing Often we'll factor authorize purchases once we start, $20,000, $50,000 repairs, because these are, not cheap, so we take them to the max.
What is the Q's truck? I don't-
They're camera trucks, they're big box trucks. You walk in, they've got multiple computer screens. Sends a little robot down to the sewers to camera all this.
Oh, okay. you
Yep.
could- Okay, all right.
Yep.
gotcha.
Yep.
Okay. Seeing no further questions, I'll make a motion to approve this item. Is there a second? Second by Councilwoman Baker. All in favor, say aye. Aye. Opposed? The item is approved.
Thank you.
The next item is BC 2022-307, Office of Innovation and Performance, submitting an RFP exemption, which will result in a grant award via an agreement to Cuyahoga County Board of Health in the total amount not to exceed $2,900,000 to support various mission activities commencing upon agreement signature of all parties for a period of 3 years.
Catherine Tkachuk, Office of Innovation and Performance. So this is our contract with Board of Health for some of the remaining things around the ARPA-related dollars. So if you remember, there was $1.5 million for various operations and testing. $400,000 of that went directly for their testing and vaccination work with Metro. So this is the remaining $1.1 million, as well as the additional $1.8 million for their work with lead remediation.
Thank you, Catherine. Questions from the board? Councilman Miller.
First, I'm very happy to see this lead remediation work being done. It's a very important problem, both within the city of Cleveland and in the rest of the county. And my question is who's eligible to receive this assistance, and how will houses to be remediated be chosen?
I'm going to have Sarah from the Department of Development come up and answer that.
Good morning, Sarah Parks Jackson, Department of Development. We have ongoing contracts with the Board of Health for lead remediation. Generally, it requires a child in the home that is under 6, because the data shows that the lead remediation, the lead levels that cause the disturbance are basically in small children who are ingesting either the dust or chips from peeling paint or whatever. So more than likely, it'll be the Board of Health will use the same requirement, even though this is not HUD money. They do have HUD money for lead remediation, and those are the standards that we go by for that.
And is it low-income households that couldn't afford to pay for their own remediation?
Yes, the targeted households are low to moderate income families with a child under the age of 6 years old.
Okay, great. Thank you.
Yes, please, Councilwoman Baker.
Yes, I too am glad to see that this is moving forward. How many homes can you remediate for this amount of money? Is it meet some of, I mean, how much, a percentage? Is it 10% of the homes, half the homes? Far will this stretch?
It's hard to say, because the cities, the suburban cities that have more lead in the homes tend to be the inner ring suburbs.
Right.
And it depends on that population of housing in those suburbs. So, for example, in East Cleveland and Cleveland Heights with much older homes is going to be a higher cost versus Shaker's a higher cost versus as you move forward or move back.
Right.
Those cities don't have as many homes. So I think the Board of Health has like a top 6, which is East Cleveland, Cleveland Heights, I believe Lakewood, Shaker. Those suburban communities we know that have the century homes, or the homes that were built before the 1950s and lead paint was used in those structures. So, and then you have to add the children.
Right.
So it's hard to give you a guesstimate of how many homes.
How will the residents of these homes know about this program that is coming out now to their suburban area? even if it is inner ring suburbs. How are you communicating with them to know that if they have a child under 6 and they live in a home before the 1950s, that your house could be compromised and checked?
The County Board of Health does all the marketing, but they also work with all of the medical institutions because a lot of times those children show up in hospitals.
Yeah.
So they're working with the medical institutions, they're working with the mayors of those communities to make them aware, they're building and housing departments to make them aware. And over the years, we've not lacked in the number of people being aware that funding was available for lead remediation.
Okay, well, that's good to know. I'll certainly try to get the word out too.
And the city of Cleveland also, let me add that, the city of Cleveland, when people call their lead remediation, will refer back to the County Board of Health if they're not in their service area.
And it can be a proactive call,
Yes.
right? It doesn't have to be someone who's sick or in the hospital. They could just say, I think I qualify.
Right, they can. And a lot of times they could possibly be having work done on the home.
Right.
And the contractor themselves just identifies it as lead paint and urges them to call the Board of Health because they won't move forward with the scraping of the home until the lead's removed.
Right, and this program then would exist.
Yes.
Yeah. Can I ask a question on the response for the COVID? Is that you also, or what type of response efforts are you putting the 1.1 million in at this
Yeah,
point?
so it's, a lot of it is for still Board of Health costs with contact tracing for some of their software, again, computer software that does that, and some of the work where they're still managing a lot of that. So the testing and everything was specifically kind of pulled out from that, but a lot of this is for their efforts that they're doing.
Okay, and if we were to have another unfortunate spread of a new COVID, would these dollars, are they kind of put in reserve for any up-and-coming issues that may come up? Or is this something that's going to be spent today in contact tracing and things like that?
So there are some things that they're using to try, like, for example, some of their computer systems to improve contact tracing. So that's going to be in existence if there's a surge in some of those efforts. I believe this is what they've identified as what their need would be, and that assumes there may be a potential increase with a new surge if that happens.
If I just make one
Please,
more,
yes.
I know the Board of Health struggled with their computer system, trying to even figure out how many cases there were, and is that being addressed, or
Yeah, that's one of the things that is actually being paid for out of these dollars.
that they can be able to track the cases better and
Yes,
hospitalizations?
and get more data and
death?
all of that, yeah, and understand the data better.
Good, okay, thank you.
Sure. Mr. Boyle?
I'm glad to hear that both these programs are working through the Board of Health and what I would say is on either a parallel or at least a consistent track with the city of Cleveland. Obviously, the lead situation in the city of Cleveland is well documented. I think that this, from a suburban side, and I give the administration a lot of credit, this is absolutely essential and if anything, overdue and probably not enough money. I mean, as Ms. Parks Jackson had mentioned, the issue of lead in the inner ring suburban communities has been long documented and largely, I don't want to say ignored, but not really addressed. And so I give the administration credit for both of these outreaches because I think they're so important. And, if you'd asked me that 3 months ago, I said, well, COVID's over, why are we doing it? But it's not. And I think that these type of steps, again, the city of Cleveland having their own health department, but I think running what I would say is a kind of a comprehensive strategy of data tracing, documentation, et cetera, will be essential for what I think is our new normal, which is dealing with these things. So I thank you, and I think they're both excellent programs and well documented.
Okay, very good, thank you.
Mark that down. I'm usually not that.
I know,
supportive.
very positive today. Positive Monday. Okay, seeing no further questions, I will make a motion to approve the item. Is there a second? Seconded by Ms. Nicole English. All in favor, say aye. Aye. Opposed? The item is approved. Moving on to consent agenda items.
The consent agenda items are BC 2022-308 through BC 22-311.
Okay. Not too too much there today, board members. If anyone has a question, feel free to ask.
No, that was the last one.
Are there any questions, board members? Nope, seeing none. I will make a motion to approve today's consent agenda items as listed. Is there a second?
Second.
Seconded by Ms. Lee Tucker. All in favor, say aye. Aye. Opposed? The item is approved. Moving on to other business.
There's no other business.
Is there any public comment?
No other public comments.
Thank you. I'm going to make a motion to adjourn. Is there a second?
Second.
Second by Ms. Lee Tucker. All in favor to adjourn, say aye. Aye. Opposed? We're adjourned. Thank you.